let's practice some appendicular bones. When we did axial and the skull and the vertebrae and all of that, I was jumping around between bones, asking features here and there. I'm going to stay on one bone at a time, but I'm not necessarily always going to be in the lower or the upper appendicular the whole time. Let's start with this bone. What bone is this? I recommend writing it down, just getting used to spelling the words. This is a tibia. It's very thick. This is a leg bone. And there's this little pointy part here that reminds me that's the forward side. This is the anterior face of the bone. Which end, now of course you don't need to write this down, but just like point at the picture, which end is the distal end? Hopefully you said down here. And at the distal end, what feature points down? That's the medial malleolus. That's the bump on the inside of your ankle. And right here in this space is where the talus would sit and the fibula would sit next door. Is this a left or is this a right tibia? So again, I'm showing you the anterior face. What side of the body does this belong on? 50-50, right? Well, there's a trick. We know this bone is in the medial part of your body. It's in the middle. And this bump must be the inside of your ankle. So if I pick up my left leg, I'm not going to be able to get it high enough to see all the way. That's actually okay-ish. So front, if I put it on my left leg, that places the bump on the outside of my ankle. So it's not a left. It has to be a right, because if I set it on my right leg, now the bump is in the correct place. So this is the tibia. Lastly, what is this knob area where another bone sits on top? Because this is the medial malleolus and I went straight up from there, this is the medial condyle. The lateral condyle would be the other side. And then I could also ask questions like, what bone sits right here? Well, it'd be the femur. Or what bone would sit on the anterior face? The patella. Tibia. What's this bone? Hopefully you said scapula. Is this a right or is this a left scapula? Here's how we figure it out. This is the spine of the scapula. If I grab it like a handle and I put it on my back, the arm bone has to be on the outside of my body. So this would not make sense, because then it would mean the humerus is hanging out the middle of my back. This is a left scapula. The acromion points over the shoulder that it belongs to. So I already told you, this is the spine, and the spine becomes the acromion, or the acromion process. I would make sure that you can spell that word, so maybe you jot it down and go check your spelling on it. What process is this? It looks like a little finger. We can see it better from the posterior side. This is the coracoid process. What's this? That's the glenoid or glenoid cavity or fossa, where the head of the humerus fits. What border is this? Now, I don't know if you caught that, but I just turned it around before I asked you that question. Fail-safe method is to notice where the arm goes. The arm goes on this side, and that's always the lateral side. So this would be the lateral border. This is the medial border. If I were to turn it around, that moves where medial is, you know, relative to what you're seeing. But this, the rounder part, is closest to your spine. The superior border would be the part up at the top. So that's the scapula. What bone is this as a whole? Common name is hip bone. Asakaxa would be a better term here. And if I wanted you to break up the bones, what bone is up here? That's the ilium. What bone is this back here? Gets a little bit harder to tell, doesn't it? The flat side is where the pubic bone is, because the pubic symphysis is there. So this part back here has to be the ischium. On this one I have the 3 drawn in. So notice, so difference there. And if I were to hold it up to a pelvis, so this is a hip bone, this is a pelvis, because the pelvis contains the hip bones, the sacrum, and the coccyx. This goes on this side. Notice the locations of all of those bones. While we're on the hip bone, what is this called? And what's it for? This is the obturator foramen. It's where blood vessels, nerves, all that kind of stuff passes through. I already told you, pubic symphysis, also sometimes shown as pubis symphysis, would be here, where the 2 hip bones would meet. So make sure you can spell it. You might want to jot that down and check your spelling of it. What's this feature called? That's the acetabulum, where the head of the femur fits in. The last feature that we learned about in our class is this ridge. What is this called? Because this is the ilium, that's the iliac crest. When you put your hands on your hips, that's what you're feeling. First of all, foot. Which way does it go? Does it go this way? Or does it go this way? It's like at the eye doctor. 1 or 2. They're not the same. This part down here is kind of like a gun handle. That's how you would hold the foot here. So this is down and this part is up. What bone is this one? That's the calcaneus. Watch your spelling. There's no O in the word. People like to put an O in that word. What group of bones would be these up here? Those are the phalanges. Sorry, that was a bad mark because I went through a lot of them. So phalanges would be up here. If you were like, oh, I don't know the answer, you were right. Down here, what would these be? These are the metatarsals. What is this bone specifically? It's the talus, where the tibia sits on top. And then these bones, where technically the talus and calcaneus also fall into this category. Those are the tarsals. Tarsals, metatarsals, phalanges. Hand. What are these called? They're the carpals. 8 carpals, 7 tarsals. What are these? Metacarpals. Make sure you're spelling them right. They're P-A-L-S, not P-E-L-S. Up here, and then there's only 2 in the thumb. We have some more phalanges. Is this proximal or distal as a phalange? That's distal because it's as far away from the joints as possible. That's your hand. What's this? It's a clavicle. Watch your spelling, C-L-A-V-I-C-L-E, not E-L. And what bone would be found on this side? And what bone would be found on this side? The flat side is the sternal side. So the bone is the sternum. Remember, you can feel that in your neck. You can feel that bony flat edge. I would also accept manubrium because that's the specific bone of the sternum. The sternum is broken into 3. This side is the scapular side. So scapula would be the answer for the rounder side. And the feature that it happens at is the acromion or the acromion process. That's all you need to know for that bone. No left or right for that one. What bone is this? Now, some people might be tempted to say radius, but this is a fibula. This is a radius, which of course without something to compare to, it might be hard to tell that this is a pretty long bone compared to the length of the radius. But when I was holding it close, the radius has that flat head, which we don't see on this bone. We've got a couple pointier projections. So this is the side that would be up by the knee. It doesn't form the knee joint. It's kind of hidden behind the tibia. So would this be the proximal end or the distal end? Proximal means closest to the joint. So this would be the proximal end. What do we have down here? What's that feature called? This is the lateral malleolus, the outer ankle bump. That's all you need to know on the fibula for me. Since we just talked about the radius, we know that that's the head of the radius, must be the proximal side because that helps form the elbow joint. What's this? And what's its job? Radial tuberosity, biceps tendon attaches there. Down at the distal end, what's this? It's the styloid process. And in anatomical position, is this bone more lateral or is it more medial in the body? My trick, if you hold out your arms like you're holding a beach ball, if the ulna is under, the radius is on the thumb side, and in anatomical position, our hands are pointing forwards. So this is a more lateral bone in the body in anatomical position. What bone is this? The big one. Should be easy. That's the femur. Are you looking right now at the anterior or posterior side? I'm going to flip it. Go back. So is this the anterior or posterior side? Right now you're looking at the back, so that's posterior. There's this big groove here. The front has a smooth surface that we don't have on the back side. Knowing that now you're looking at the front, is this a left or is this a right femur? If I were to just take this down and put it on my body, this is what makes sense here going into the hip socket. This would be weird. My hip would be way over here. This is a left femur. What's this right here? You can see it from the front and the back. See, lesser trochanter, and the big one up at the top is the greater trochanter. You have the head of the femur here. What is this? So let me back up again so you can see which side is which. Medial side, because this goes in the hip, and the hip is more in the middle of your body. Medial condyle. This would be the lateral condyle. And lastly, that smooth surface, what is that called? That is the patellar surface. Here's the patella that sits within the quadriceps tendon on that space with the tibia there as well. We have only arm bones left. We already went over the radius. What's this? It's got a U for ulna. And down at the bottom of the ulna, what's that? Styloid process, just like on the radius. Over here, we have a little spot off to the side. What's that? Radial notch. Fits in like so with the radius. These might not be from the same side of the body. I just randomly grabbed one. What is this top part called? Olecranon process. What's the middle part called? The trochlear notch. Bottom part. The coronoid process. And remember, the coracoid is on the scapula. Like, think of how many C sounds are in there. Coracoid, scap has that C. Whereas this is the coronoid. That's in the ulna. Coronoid and ulna. And the last bone is this one. What's this? This is the humerus. Right now, are you looking at the front, the anterior side, or the back posterior side? I'll flip it. This is the posterior side because this feature we can only see on the front. What's that feature called? That's the capitulum. What's this divot called? Coronoid fossa, because the coronoid process fits into it. The big one on the back, what's that one called? The olecranon fossa. Like, oh, it's big compared to the other one. Olecranon fossa. What's this thing called that we can follow from front to back and the ulna really locks into that? That's the trochlea. This is the distal end. When we go up to the proximal end, we've got the head. And then we have two bumps here. What's the higher up one called? It's the greater tubercle, and then you've got the lesser tubercle on the femur. They were bigger and they were called trochanters. From the plastic bones, it's a little bit harder to find these, but there's this little part that kicks out to the side. It's a little bit rough. That's called the deltoid tuberosity. Because it's hard to find on my plastic bones, I wouldn't make you do this. Deltoid tuberosity, though, like if it was a multiple choice question, what muscle attaches there? It's right in its name, the deltoid. And the other thing that's really hard to see on these plastic models is the radial groove. It's like a small pathway down this bone that allows the radial nerve to run along it. I wouldn't have you find it on the bones just because it's hard to see, but you could have a multiple choice question asking about it. So with that, we just reviewed all the bones. The very last thing then would be if I pick up the two pelvises here, which one's male and which one's female. So I'll rotate them. Hopefully you looked right here, even though, you know, you can look at the flaring of the bones and everything, but look how wide this angle is and how narrow that angle is in comparison. So the one in my left hand is the female pelvis. That concludes all of your upper and lower appendicular bones.